Before beginning morning care for a resident, the nurse aide should first A. Open the window for fresh air. B. Explain the procedure to the resident. C. Gather all the supplies and start immediately. D. Ask another nurse aide for help without informing the resident. Answer: B. Always explain any procedure to the resident before starting to promote dignity, understanding, and cooperation in care. When transferring a resident from a bed to a wheelchair, the nurse aide should A. Pull the resident by the arms. B. Lower the bed to its lowest position. C. Ensure the wheelchair brakes are unlocked. D. Have the resident hold on to the aide's neck. Answer: B. Lowering the bed to its lowest position ensures stability and safety during transfers, preventing falls. A resident who is on a mechanical soft diet should be given A. Fresh apple slices. B. Cooked mashed vegetables. C. Tough pieces of steak. D. Hard granola bars. Answer: B. A mechanical soft diet includes foods that are easy to chew and swallow, such as mashed or finely chopped foods. What is the best action when a resident refuses a bath? A. Force the resident to bathe. B. Notify the nurse and document the refusal. C. Ignore the refusal and leave. D. Try again later without explaining. Answer: B. Residents have the right to refuse care. The aide must report and document the refusal appropriately. When removing dirty linens from a resident's bed, the nurse aide should A. Place them on the floor until finished. B. Carry them close to the body. C. Hold them away from the uniform. D. Shake them to remove debris. Answer: C. Holding linens away from the uniform prevents contamination and spread of microorganisms. Which of the following actions promotes resident dignity during dressing? A. Dressing the resident quickly without discussion. B. Closing the curtain and allowing choice of clothes. C. Dressing the resident in any clean outfit. D. Ignoring resident preference for speed. Answer: B. Providing privacy and offering choice promote independence and dignity. When documenting care, the nurse aide should A. Record before providing care. B. Record only what seems important. C. Record care immediately after completion. D. Record in advance for convenience. Answer: C. Documentation should always be accurate and completed right after care is provided. A resident is choking and cannot speak. The first action is to A. Perform chest compressions. B. Encourage coughing. C. Begin abdominal thrusts. D. Offer water to drink. Answer: C. If the resident cannot speak or breathe, immediate abdominal thrusts are necessary to remove the obstruction. Which statement about infection control is correct? A. Handwashing is only needed after visible contamination. B. Gloves eliminate the need for hand hygiene. C. Handwashing is the most effective way to prevent infection. D. Only nurses are responsible for infection control. Answer: C. Handwashing remains the most effective method to prevent cross-contamination and infection spread. When communicating with a resident who is hearing loss, the nurse aide should A. Speak loudly while facing away. B. Shout to gain attention. C. Face the resident and speak clearly. D. Avoid using gestures. Answer: C. Facing the resident and speaking clearly aids lip reading and comprehension without shouting. What is the correct way to measure a resident's radial pulse? A. Use the thumb and count for 10 seconds. B. Place 2 fingers on the wrist and count for 1 minute. C. Estimate based on breathing. D. Use any finger and count for 15 seconds. Answer: B. The radial pulse is measured with the index and middle finger for 1 full minute for accuracy. When a resident is on a fluid restriction, the nurse aide should A. Offer fluids as usual. B. Record all intake and report excess. C. Avoid giving any water. D. Encourage family to bring drinks. Answer: B. Recording intake and following restrictions exactly ensures safety and prevents fluid overload. Which is the correct way to identify a resident before care? A. Ask the roommate. B. Use the wristband and verbal confirmation. C. Ask another aide. D. Guess based on the room assignment. Answer, B. Always check the wristband and confirm verbally to prevent errors in care delivery. The first step in the nursing process is A. Implementation. B. Evaluation. C. Assessment. D. Planning. Answer, C. Assessment gathers information about the resident's condition to form the care plan foundation. When assisting a resident to ambulate with a gait belt, the aide should A. Hold the resident's arm. B. Hold the belt at the back. C. Pull on the belt forcefully. D. Allow the resident to walk unsupported. Answer, B. Holding the gait belt from the back provides control and balance support during ambulation. A resident's call light should always be A. Placed within easy reach. B. Left on the floor. C. Taken away when the aide leaves. D. Placed at the foot of the bed. Answer, A. Keeping the call light within reach promotes safety and resident independence. A resident complains of chest pain. The nurse aide should A. Offer water. B. Stay with the resident and call for the nurse immediately. C. Ignore until the next round. D. Help them lie down and leave. Answer, B. Chest pain may indicate a medical emergency. The aide must stay and alert the nurse right away. When cleaning dentures, the aide should A. Use hot water. B. Place a towel in the sink for protection. C. Use bleach for disinfection. D. Hold them tightly over the sink. Answer, B. A towel or water in the sink prevents dentures from breaking if dropped. A resident with Parkinson's disease may need help with A. Decision-making only. B. Fine motor tasks like buttoning shirts. C. Reading instructions. D. Remembering names. Answer, B. Parkinson's affects muscle control, making fine motor tasks difficult. What is the correct response when a resident reports pain? A. Report to the nurse immediately. B. Wait until shift end. C. Give medication if available. D. Ignore complaints. Answer, A. Pain should always be reported promptly so the nurse can assess and manage it. Proper body mechanics include A. Bending at the waist. B. Lifting with leg muscles. C. Twisting while lifting. D. Standing with feet together. Answer, B. Lifting with the legs prevents back injuries and maintains safe posture. A resident with diabetes requests extra dessert. The aide should A. Give it as a treat. B. Refuse and scold the resident. C. Politely explain and inform the nurse. D. Ignore and continue. Answer, C. Dietary restrictions must be respected and reported to ensure proper management. The term PRN on a medication order means A. Once daily. B. As needed. C. Before meals. D. Every night. Answer, B. PRN stands for as needed, indicating non-scheduled medication use. When providing perineal care to a female resident, the aide should A. Wash from back to front. B. Wash from front to back. C. Use the same cloth for all areas. D. Skip rinsing if soap is mild. Answer, B. Washing front to back prevents the spread of bacteria from the rectal area to the urethra. The best method to reduce pressure ulcers is to A. Keep the resident in one position. B. Encourage regular repositioning. C. Avoid using pillows. D. Use plastic sheets. Answer, B. Repositioning prevents prolonged pressure and improves circulation to reduce ulcer risk. The primary purpose of using standard precautions is A. Protect only residents. B. Protect both staff and residents. C. Avoid handwashing. D. Save time during care. Answer, B. Standard precautions protect everyone from potential infection transmission. Which temperature method is least invasive? A. Oral. B. Axillary. C. Rectal. D. Tympanic. Answer, B. Axillary temperature is taken under the arm and is the least invasive method. A confused resident tries to leave the facility. The aide should A. Block the door and shout. B. Calmly redirect and inform the nurse. C. Physically restrain without order. D. Allow them to go. Answer, B. Calm redirection and immediate reporting ensure safety while respecting resident rights. If a resident's family is arguing loudly in the hallway, the aide should A. Join the discussion. B. Ignore the situation. C. Notify the nurse to handle the matter. D. Ask them to leave immediately. Answer, C. Only licensed staff should mediate family conflicts to maintain professionalism. The safest way to dispose of a used razor is A. Wrap it in paper and trash. B. Place it in a sharps container. C. Rinse and reuse. D. Leave it on the sink. Answer, B. Used razors are considered sharps and must go in an approved sharps container. The first sign of dehydration in elderly residents is often A. High fever. B. Dry mouth and lips. C. Confusion. D. Weight gain. Answer, B. Early dehydration symptoms include dry mucous membranes and thirst. Which is the best example of maintaining confidentiality? A. Discussing a resident's condition at lunch. B. Sharing health details only with care staff. C. Telling friends about a resident's progress. D. Reading charts aloud. Answer, B. Confidential information should only be shared with those directly involved in care. When making an occupied bed, the aide should A. Leave one side rail down for access. B. Keep both side rails down. C. Roll the resident without warning. D. Skip the draw sheet. Answer, A. One rail down ensures safety while allowing access to turn and reposition the resident. During range of motion exercises, if the resident complains of pain, the aide should A. Stop and report to the nurse. B. Continue to improve flexibility. C. Ignore and finish. D. Move faster. Answer, A. Any pain should be reported. Exercises should never cause discomfort. Which of the following is a restraint alternative? A. Tying a resident to the bed. B. Using bed alarms. C. Using locked wheelchairs. D. Ignoring the resident's movements. Answer, B. Bed alarms and frequent checks are safer alternatives to physical restraints. When a resident is dying, the aide should A. Avoid the room. B. Provide comfort and emotional support. C. Discuss other residents' care. D. Stop all interactions. Answer, B. Providing comfort care maintains dignity and compassion during end-of-life care. Which task can a CNA legally perform? A. Administer 4 fluids. B. Measure vital signs. C. Change wound dressings. D. Prescribe medication. Answer, B. CNAs can measure and report vital signs but cannot perform clinical nursing tasks. When emptying a urinary drainage bag, the aide must A. Record the output. B. Leave it half full. C. Disconnect the tubing. D. Pour contents into a toilet directly. Answer, A. Output must be measured and documented for fluid balance monitoring. Which of the following promotes good communication? A. Interrupting frequently. B. Active listening and eye contact. C. Avoiding eye contact. D. Speaking rapidly. Answer, B. Active listening shows respect and builds trust between aide and resident. If a resident falls, the aide should A. Help them up immediately. B. Check for injuries and call the nurse. C. Leave to get help without observing. D. Ignore if no one saw. Answer, B. Safety first, never move the resident until the nurse assesses for injuries.